Let's start by understanding what neuromuscular blocking drugs, often called muscle relaxants, actually are. These medications are primarily used in medical settings to cause temporary paralysis of skeletal muscles. They work by interfering with the transmission of signals from nerves to muscles, making them essential during surgeries and certain medical procedures. By blocking these signals, muscle relaxants help prevent unwanted muscle movements, making procedures safer and more controlled for both patients and healthcare providers. It's important to note that these drugs do not affect consciousness or pain sensation, so anesthesia is still required. Now, let's explore how these drugs work in more detail. Neuromuscular blocking drugs function by targeting the communication between nerves and muscles. Normally, nerves release a chemical messenger called acetylcholine, which binds to receptors on muscles and triggers contraction. Muscle relaxants block these receptors, preventing acetylcholine from activating the muscle. There are two main types: non-depolarizing agents, which block the receptors, and depolarizing agents, which mimic acetylcholine but keep the muscle in a state where it can't contract again. This mechanism is crucial in surgeries, as it allows doctors to perform delicate operations without interference from muscle movements. Next, let's look at some common uses and safety consideration. Muscle relaxants are most commonly used during surgeries to ensure muscles remain still, making procedures like intubation and abdominal operations much safer. They are also used in intensive care units to help patients on ventilators. However, because these drugs can cause complete muscle paralysis, careful monitoring is essential. Healthcare professionals closely watch patients' breathing and vital signs, and the effects are reversed with specific medications once the procedure is over. Understanding the role and risks of neuromuscular blocking drugs helps ensure they are used safely and effectively in medical practice.